So this is a part 6 of the integumentary system, the last part where we'll be talking about the Mohs micrographic surgery and then the certain procedures on the breast, which mainly include the biopsies and mastectomies. So what is Mohs micrographic surgery? It is a highly specialized technique used for the removal of certain types of skin cancer. This procedure involves excising the tumor layer by layer and examining each layer under microscope in real time to ensure complete removal of the cancer cell while preserving as much healthy tissue as possible. Mohs surgery is a definitive surgical procedure that removes the tumor with immediate pathology review. Now, why do we need to code biopsy separately? Before performing the Mohs surgery, a confirmed histopathological diagnosis is required. If there is no prior confirmation, a diagnostic skin biopsy is performed first. And for that, a separate diagnostic procedure we carry out and we write the code for those biopsy 11102, 11104 and 11106. It depends whether you have carried out punch, tangential or incisional biopsy. And so we take the biopsy first, we find out whether the lesion is benign and malignant, and if it is a malignant then we decide to go for the Mohs surgery, and for which we have the code 17311 to 17315. The skin biopsy code is reported with the modifier 59. In case if we do the skin biopsy, get the diagnosis, and if the diagnosis is malignant and then we carry out the Mohs surgery, then the skin biopsy codes are written by the modifier 59. And if it is a frozen section may also be reported, then in that case we code it 88331 with the modifier 59. So these are very important guidelines. So this is a diagrammatic presentation for the Mohs surgery where you can see the cancer here, and then what do we do is we excise that cancer or we take out the cancer in a layer and immediately we see it under under the microscope to review the things under the microscope. Then we go again, take out one more layer, and this process continues till we see all normal cells under the microscope. That means we have taken all the cancer cells and now what is remaining is absolutely normal cell, and then you close down this defect. So we know what is Mohs surgery. It was invented by the Frederick E. Mohs, a general surgeon who developed the procedure in 1938. Now, if we see the guidelines for the Mohs surgery for the CPT, first of all, you have to identify the anatomical site to which this particular surgery carried out, because here also we have the different body groups. Then identify the stage. Each stage include the 5 tissue blocks only. If more than 5 tissue blocks are there, then we have to assign a code which is only for the blocks. So, and then the code repairs or the graft if performed with MMS with an additional code, and do not code the surgical pathology codes, that is a biopsy code with MMS. In case if it is carried out, we need to write that code along with the modifier 59. So let us see what are the codes for the Mohs surgery. The first code is 17311, and here we need to check the body group, and the body group is head, neck, hands, feet and genitalia. And the important thing is this particular code is for the first stage up to 5 tissue block. So it covers only the first stage and only 5 tissue block. Then there is the add-on code 17312. It is for each additional stage after first stage up to 5 tissue blocks. Means 17312, it talks about each additional stage, and if that stage also include only 5 tissue block. So if you see these two code 17311 and 17312, ideally it belongs to one family. Okay, and then we have the code 17313 and 17314. Here if you see the language of this 313 is exactly like 311, except the body group is different. Okay, the body group is different, and this first stage up to 5 tissue block it remains same. This language remains same. What is different in this particular thing is basically the body group. And then this is a add-on code. So we have one more, the group, body group, and that is this group. Okay. Now I want you to have a complete attention to the code 17315. This code is different because here the language of the code is Mohs micrographic technique, including removal of all gross tumor, surgical excision of the tissue specimen, mapping and color coding of the specimen, microscopic examination of the specimen, each additional block after the first tissue block, any stage. So this particular 17315, it is a common code for all this code, and it only counts the number of the blocks because this covers, so remember 17311 and 17313. This 17311 and 313, it covers first stage 5 tissue block. 17312 and 17314, it covers each additional stage after the first stage but only 5 tissue block. And 17315, it covers only the additional blocks in all the stages after the 5 tissue blocks. So I'm going to give you an example for you to understand this very well. So whenever you are doing the question related to Mohs micrographic surgery, first of all, you need to understand and you need to highlight important word. A 65-year-old retired accountant arrives to the dermatologist's office to removal of the squamous cell carcinoma of the left cheek. So the area is important because we have seen there are two body group and the upper back. So there are two areas, left cheek and upper back. The cheek require 5 stages. The first stage was cut into 2 blocks. So the first stage into 2 blocks. The second stage has 10 blocks. The third stage has 5 blocks and the fourth stage has 7 blocks. And the fifth stage had no blocks. The upper back lesion required 2 stages, both had 10 blocks. So the physician performed the pathology of the tissue from the cheek and back, verifying the cancer and had been eradicated from both the sides. Which procedure code best describes this encounter? Now this is the question which has two areas, cheek and upper back, and in the cheek area they have taken down 5 stages because it is clearly given first, second, third, fourth, fifth, and then for the upper back they have taken only 2 stages, but every stage has 10 blocks. Now we will go into the detail of this. Whenever you are attempting the Mohs micrographic surgery, you should always write the stages and the block. Now, according to the answer is the correct answer. So let's solve why the answer is the correct answer. So in the cheek area, they have done the 5 stages, required 5 stages. So we are going to write all the stages, that every stage and the respective block. So I'm going to write that for the cheek, and even for the trunk also we require the 2 stages and 10 blocks. So I'm going to write that. Now remember, for the cheek area we will have to zero down the code 17311 because it is written Mohs micrographic surgery, first stage, head, neck, hands, feet, genitalia. So remember, this is for the head, and if you see the part of the cheek, it comes on the head. So for which I am going to take the code 17311. But how many stages are there? There are 5 stages. So 17311, it will cover only the first stage up to 5 tissue blocks. So 2 blocks for the 2 blocks. So till 5 block, I am going to write the code 17311. Now the additional stages for which I am going to take the code 17312. It says each additional stage after the first stage used with the 17311 up to 5 tissue block. So it covers only 5 tissue block, and so every stage after the first stage I am going to code it by the add-on code. and it covers 5 tissue blocks. But if you see the stage 2, it has 10 blocks. So it has additional 5 blocks. And stage 4, it has additional 2 blocks. So I'm going to keep those blocks separately. Now we come to the trunk. Trunk has the first stage 10 blocks, second stage 10 block. Now first find out the body area. The body area is trunk, for which I will require a code 17313. That is for the stage 1, and for the stage 2 we will require a 17314. That is an additional code for every additional stage. Remember that add-on code starts for the every additional stage, and here 10 block 10 block, so it has extra 5 blocks and extra 5 blocks. Now we know the 17315, it talks only about the additional block beyond 5 per stage. Now additional blocks is 5 plus 2 plus 5 plus 2, and that's why we will write 17315 into 70. So this will be my answer. So remember that. Now let us take one more example. Patient has basal cell carcinoma on his upper back. Upper back is trunk. A map was prepared to correspond to the area of the skin where the excision of the tumor will be performed using Mohs Micrographic Surgery technique. The minute you hear the word MMS in the question, you have to only look for stage block, that's it. There were 3 tissue blocks that were prepared for cryostat section and removed in the first stage. The second stage had 6 tissue blocks which were also cut and stained for the microscopic examination. The entire base and the margin of the excised pieces of the tissue were examined by the surgeon. No tumor was identified after the final stage of the microscopically controlled surgery. What procedure codes are reported? So whenever we are doing the questions related to the Mohs surgery, first of all, the area is important because we have the body group, and then the stages. So here you will see that the 3 tissue blocks which are removed, and that is from the first stage, and in the second stage we have removed 6 tissue blocks. Now this much of data we have, so we will put that data and we will write the answer. This is the answer: 17313, 314 and 315. Most codes are based on the anatomical grouping by the code, the number of the stages taken and the number of the block per stage. The surgery was on the back, reporting 17313 for the stage 1 with the 3 blocks. Add-on code 314 is for the stage 2, 5 blocks. But in our example, there are 6 blocks. So 1 block is extra, and for which I am going to write 17315 for that 1 extra block in the stage 2. And that's why my answer is 17313, 17314 and 17315. So the Dr. Alex completed Mohs surgery on the Ralph's left arm. She reported routine stain on all sides. Slides, mapping and color coding of the specimen. The procedure was accomplished in 3 stages, and 3 stages with a total of 7 blocks in the second stage, and it done on the left arm. Always remember the drill that whenever it is Mohs surgery, what we are looking for is the area, how many stages, how many blocks. So in this case, 3 stages with 7 blocks in the second stage. That means the first and the fifth stage had 5 blocks. So what I will write, the area is left arm, so I will require the code 17313. That is for the first stage 5 blocks. Second stage and third stage I am going to write 17314 into 2, and we have a 17315 into 2, that is for the additional 2 blocks in the second. So this way we have finished with the Mohs surgery, and then the next important topic is going to be the breast and breast related procedure, and in that we are going to learn the mastectomy and the biopsy. You must know what is the medical terminology. Master is a breast and ectomy is removal, denoting the surgical removal of the specified part of the body. Now, whenever you are doing the question on the breast, understand what procedure is done on the breast. Check if the procedure is unilateral or bilateral, because many a time for the bilateral procedure, the modifier 50 or LT and RT is reported. Placement of the localized device is important, and read the image guidance modalities carefully. Now, what are the guidelines? First of all, identify excision or biopsy. In biopsy procedure, physician may perform the biopsy three ways. One is with image guidance or without image guidance. Second is a closed procedure. Third is open procedure. Code for each lesion separately, and you have to append a modifier 59 for subsequent or additional lesion. The codes related to the breast, it starts from 19000 and it goes on till the end of the chapter. Remember here the important word is to read the procedure and read the medical terminology. Now if you see, this is the puncture of the cyst. And if you see this code, this is a very important code. This is a code 19020 and it says mastotomy. Now, what is a mastectomy? It is nothing but it is a incision of the breast. What is a mastectomy? It is a surgical procedure that removes the part of the part or all of the breast. And what is a mastopexy? It is nothing but the breast lip surgery. So all these three terminologies are very important in this particular chapter, and you must pay attention. So let us take this question and let us see how do they test. During the self-breast exam, Julie felt small hard nodule in her right and left breast. She was examined by her physician, who also felt the nodules. The physician diagnosed a simple breast cyst and recommended puncturing using the ultrasound guidance. A sterile needle is inserted into the cyst of the right, and the cyst is drained. Attention is turned to the left and left cyst, and the same procedure is performed. Now we need to check what is the we need to eliminate the wrong answer and we need to check what is the correct answer. So first of all, what is the absolute wrong answer? The C is absolute wrong answer because I can see the 51 modifier which is there on the add-on code. So I'm going to eliminate the answer C. Even A is the wrong answer because you can write one primary code. When there is add-on code, it is only one primary followed by add-on code. So, and there is add-on code here I can see. So A is also not the correct answer. Now we will check the code B. So the code B says 19000, that is a puncture aspiration of the cyst of the breast that has happened. And so for the right cyst we are going to use 19,000, and for the left each additional cyst we are going to use 19,001. There is a parenthetical note below and we are going to read both the notes. First is use 19001 in conjunction with 19000. That means I will require to use this code along with this code. And there is another important note that if the image guidance is performed, use 76942 and 77021. 76942 is for the ultrasound guidance and 77021 is for the fluoroscopic guidance. In our case, what is the guidance? It is the ultrasound guidance. So by considering all these things, what is the correct answer? The correct answer is B. Now, a breast biopsies can be carried out through several methods. One is core needle biopsy, and the second is surgical biopsy, which is also called as open biopsy. That is further divided into incisional and excisional. That depends on the size and the location of the suspicious area and the imaging used to guide the needle. So the key point for the breast biopsy is, if it is a excisional, this code is used when the entire suspicious breast lesion is removed during the biopsy procedure. While incisional, this code is used when only a sample of the lesion is removed for the diagnostic purpose. And image guided biopsy, the codes are different, 19081 to 19086. These codes are used for the biopsy performed with the image guidance like ultrasound or mammogram with a different codes depending on the modalities used. So this is a very important thing. excisional when we are taking out the whole lesion. So these codes are very, very important. So these are the code for the percutaneous image guided breast biopsy. This code begins from 19081 and it goes on till 19086. And this code differentiation is depends on what type of guidance we have taken. Whether have we taken stereotactic guidance, have we taken ultrasound guidance, or have we taken MRI guidance. And this code include the placement of the breast localized device. So let us see the code 19081. It says the breast biopsy, placement of the breast localized device, and also what is the kind of guidance is taken. And every code has a add-on code. Now let us take two scenarios. The first is whenever the multiple breast biopsies are done under the same imaging modalities. When more than one percutaneous breast biopsy with or without localized device placement is performed using the same image modalities, use add-on code whether the additional service is on the same or contralateral breast. To report a bilateral image guided biopsies, report 19081, 19083 and 19085, which are the primary code for the initial biopsy, and the contralateral and each additional breast imaging guided biopsy we will use the add-on code, and these are the add-on code. So let us take an example. A patient undergoes two ultrasound guided breast biopsy, one on the left breast and one on the right breast. So the initial biopsy I will write with a 19083 and the contralateral I will write 19084. Now second scenario, when multiple breast biopsies using different image modalities. If the additional percutaneous biopsy with or without localized device placements are performed using different image modalities, report another primary code for each additional biopsy with or without localized device placement performed using the different image guidance modalities. So for example, multiple breast biopsy using different image modalities. A patient undergo an ultrasound guided breast biopsy on the left breast and MRI guided breast biopsy on the right breast. How will I code? For the left breast ultrasound, I am going to use the primary code. And for the right breast MRI guided biopsy, I am going to use another primary code. Okay, so here we are using two primary code. I'm not using the add-on code, we are using two primary code. So this is very, very important. If you see this code in your book, you will see that every code has written the guidance. This is the stereotactic guidance. This is the ultrasound guidance, which is very, very clearly given. And all the notes are very, very important. Okay, so this is one important guidance for the ultrasound, and this is a guidance which is there for the MRI, magnetic resonance guidance. So all these are the primary code, and then there is a respective add-on code which we have already seen. A surgeon performed a bilateral breast biopsy with the placement of the localized device under ultrasound guidance. Biopsy of the left breast were taken at 3 o'clock and 10 o'clock. Biopsy of the right breast was taken at 7 o'clock with the same guidance. Now let us see what are the important thing. First of all, they have done the bilateral. On the left side they have done two biopsy, and on the right side they have done one biopsy, and the ultrasound guidance is the modalities. Now what is the guideline? That if we have done more than one biopsy, whether it is on the same side or the contralateral side, and if the modality is same, we will use one primary code and the add-on code. What is the guidance? Ultrasound guidance. So we will require 19083. That is for the first lesion, and the two additional lesions we will use 19084 into 2 because in all three biopsies are done. So now just check 19085. It is first of all, it is a code for the MRI guidance, and ours is not a MRI guidance. So let's eliminate wrong answer. Now 19083, it is primary code, and then 19084, this is not the correct answer. So we will eliminate that. And 19085, it is a MRI guidance, and 19086, it is also the add-on code. MRI guidance wasn't taken. So after eliminating all the answers, what is the correct answer? A is the correct answer. Now, this is a very important thing. These are the code 19281 to 19286. These are the code for the breast localized device placement. Now, pay attention. A breast localized device is placed to precisely mark the localization of the suspicious breast abnormality that cannot be felt by touch, allowing the surgeon to accurately target and remove only the necessary tissue during the procedure. Key points about the breast localization is the code is reported separately when performed without biopsy. The following CPT codes are used for the percutaneous image-guided placement of the localized device in the breast. This code should not be reported if the localization is performed during the percutaneous breast biopsy. Since the biopsy code 19081 to 19086 already include the placement of the localization device. So this code I will use 19281 to 286, I will use whenever we are just putting the localized device. Okay, we are not doing the biopsy, only putting the localized device. But if the localized device is placed at the time of the biopsy, we don't code them separately. This is very, very important. Okay, so remember that. And why do we put the localized device? So that it is easy for the surgeon to accurately target and remove that particular tissue. So the left breast was prepped and draped in sterile fashion. In incision from the 3 around to the 9 o'clock position on the areolar border on its inferior aspect was made in the skin and extended to the subcutaneous tissue. The breast mass was excised by a sharp dissection. The mass was found to be approximately 1.5 to 2 centimeter in maximum dimension. Hemostasis was made adequate using electrocautery and ergon beam coagulator. After this was accomplished, the skin margins were reapproximated with a running inverted 3.0 Vicryl subcuticular suture. Select the procedure diagnosis. Now they have given the code. So the 19120, it is the code for the excision of the cyst, fibroadenoma, or the other benign or malignant lesion. And here they have given the area of the breast tissue. Now the area is also given, that is the duct lesion or the nipple or the areolar lesion. And here 19301, it is a mastectomy. Definitely mastectomy hasn't happened. Now let us check the code 19125. It is an excision of the breast lesion identified by the preoperative placement of the radiological marker open single lesion. It is definitely not open, and secondly it is not placement of the radiological marker, that is not seen in our case. And 19101, it is a open incisional, it is for the percutaneous needle biopsy. So 19101 is not the correct answer. The correct answer is the excision of the lesion, the benign or malignant. Now in our case, we don't know the diagnosis of the lesion, because it is just, they have said that there is a lesion and there is a mass. So we don't know the exact diagnosis of that mass. And that's why we are going to pick up the code 19120, and then the answer will be A. So after the biopsy, the next important topic is the mastectomy. A breast mastectomy is a surgical procedure to remove all or part of the breast. It's often done to treat the breast cancer, but it can also help prevent a breast cancer in a woman at a high risk. Now, depending upon whether you are removing one breast or two breasts, we call it as a unilateral or bilateral mastectomy. And again, there is a nipple sparing mastectomy or skin sparing. So which preserve the nipple and areolar complex, and skin sparing preserve much of the breast skin. Now, if you see the code for the mastectomy, They talk about the partial mastectomy, the complete mastectomy, whether you are involving the lymph removal of the lymph node, or whether you are involving the removal of the pectoral muscle, including the pectoral muscle, axillary lymph node, internal mammary lymph node. So depending upon, we have the various code. So pay attention to the what has been removed from the patient, and depending upon that, we pick up the code. Now, after the mastectomy, the breast reconstruction may be performed using the variety of the technique and implant-based reconstruction. In immediate reconstruction, implant is primarily placed at the time of mastectomy, and for which we use the code 19340. But if it is the reconstruction is done later, that is a delayed reconstruction, implant is placed at any date separate from the mastectomy, we use the code 19342. So this is very important. This is for the reconstruction, and these are the code for the mastectomy, reconstruction and the mastectomy code. And here you have to be very particular in reading all the description. Now let us take some more example as far as the breast biopsy mastectomy is concerned. Rina, at her annual physical exam, uh, Dr. Jonas found mass in the upper outer quadrant of the patient right breast. She is scheduled today for the breast biopsy. Important word, highlight breast biopsy. 8 gauge biopsy needle was advanced into the mass under the sonographic guidance. So it is a percutaneous needle biopsy, and it is done under the sonographic guidance. And one core was taken from the mass, clip was placed. A sonographic image after the clip placement shows the clip is in the lesion. The biopsy is sent to the pathology to rule out the cancer. Now in this case, we need to code for the biopsy. The biopsy is done percutaneous, and then the sonographic is nothing but the ultrasound guidance has been taken. So by having all the description with us, we can zero down the code, and then the code will be 19083, because it is for the biopsy breast placement of the breast localization device that has also been placed in the same meeting, and it is done under the ultrasound guidance. Sonographic is nothing but ultrasound guidance. So the correct answer will be answer D. Now, let us take one more example. A 35-year-old Jennifer has a cancer in her left breast. The surgeon performs a mastectomy, removing the breast tissue, skin, pectoral muscle, surrounding tissue, including the axillary and internal mammary lymph node. Which mastectomy code is reported? Now, as I told you, here the description is important, because what has been removed? Mastectomy simple and complete. Here it is a mastectomy radical, including pectoral muscle, axillary lymph node. Pectoral muscle and axillary lymph node, but there is one more lymph node, that is internal mammary lymph node. So we have to be that specific. Here it is a mastectomy radical, including pectoral muscle, axillary and internal mammary lymph node, urban type. And here mastectomy modified radical, including axillary lymph node, with or without pectoralis minor muscle, but excluding pectoralis muscle, major. So after reading all these things, the correct answer is 19306, because include the muscles, axillary and internal mammary lymph node. Now, let us take one more example. A 60-year-old female has a right breast mastectomy. The surgeon proceeds with an immediate reconstruction and uses a biological implant for the soft tissue reinforcement. So, we need to see the option. The first option is same for all. So, let's concentrate on the second option, which will zero down our code. So, the first code is 19396. It talks about the preparation of the knowledge for the custom breast implant. That didn't happen. 342 is the insertion and replacement of the breast implant on a separate day. So definitely that is not the code, because it happened on the same day. 19340 is the insertion of the breast implant on the same day of the mastectomy. So it is an immediate procedure. But if you see this particular implant, it is a saline and silicone gel. and our implant is a biological implant because it is very clearly given here that he has used the biological implant. And if you see the code 15777, it is the implantation of the biological implant, example a cellular dermal matrix for the soft tissue reinforcement, and that is what happened in our case. So the correct answer will be D. So here from this particular example you can make out that whenever you are putting the implant, you must also see the material that they have used, because the 19340 and 342, it does talk about when the implant is placed, but it does also talk about the material they have used, while 15777 is the biological implant. So that is also one important consideration. Breast reconstruction is performed to repair the defect due to congenital anomaly or loss of breast tissue after the surgical excision, that is mastectomy. The goal of the breast reconstruction is to correct the anatomical defect and to restore form and the breast symmetry. It can be achieved using implant, which are typically made up of silicone, saline, or biological material. This implant restore the breast volume and shape after mastectomy or congenital defect. Implant-based reconstruction may involve the two stages procedure. There is another technique that is also done by utilizing patient's own tissue via flap technique to create a new breast mound. And additional procedures such as mastopexy, reduction or augmentation may be performed to enhance the symmetry. So whenever you are doing the repair or the reconstruction, one must see what has to be done. One must see then what have they used, implant or the flap, and whether it is a one stage process or whether it is a two stage process, because sometimes they have to use the two different technique. So what the doctor is doing, that is very important for you to code it accurately. So let us take this example, the pre-operative. This is the operative report. Many a time you get the operative report also. So where the pre-operative diagnosis is hypoplasia of the breast, post-operative is also the hypoplasia of the breast, and operative procedure is bilateral augmentation mammoplasty. Many a time you get the code by reading this procedure, but sometimes we need to read the procedure because you get lot more additional information when we read the procedure. The patient was brought to the operating room awake and placed in the supine position, and here they have done how the patient has been put up, and incision was made in the inflammatory crease going through the skin, subcutaneous tissue down to the muscle fascia. Dissection at the subglandular level was then performed until the adequate pocket was made according to the previous limit. After irrigation and normal saline and careful hemostasis, a Mentor and elegant silicone filled high profile texture implant was used and placed into the pocket. It was 300 cc. So the skin was closed using 40 vicryl in an interrupted fashion for the deep subcutaneous tissue. 40 menacryl in an interrupted fashion was used for the superficial subcutaneous tissue, and the skin was closed. The skin closure was the same. Both left and right breasts were similar in size and shape. The patient had a bra applied. The patient tolerated this procedure. So in this case, we need to pay attention whether they have carried out this procedure on both the side and what they have, how they have done it. So the mammoplasty has been done. That is, restoring the size, shape, and it is done bilaterally. And we have this code. So let us see the answer. So the first option is 19316. It is the mastopexy that did not happen. 19328. It is the removal of the intact implant that didn't happen because we are planning to put the implant because the patient has a hypoplasia. 19325 is the breast augmentation with the implant. So in this case, we are doing the bilateral augmentation mammoplasty, and with that is with the implant that has been mentioned in our case. So 19325 and 19340 is also the insertion of the breast implant, but it is the case for the mastectomy. R is not the case of the mastectomy, it is the case of the hypoplasia of the breast. That means the breast size was small and then they wanted to enhance the size. So this is how, and that's why the answer is the correct answer. And This is our last slide, and we have finished all the integumentary system guideline, and the next lecture is going to be the CPT musculoskeletal system guideline.